Hello and welcome to our session on the topic the fever in children. We are glad to have Dr. Ravi Kyadegeri among us today to help us understand the topic better. As we know that fever is a thing which is to be considered very crucial when it comes to children, and especially from the age of 6 months to 9 years old, which comes under our pediatric section. So I think nowadays, considering the weather and everything in mind, it is one of the most common things people are facing today, and especially new parents. I think doctor can help us and all the new parents and all the parents to just clear their doubts with the topic. So just take us through, and doctor, you have the stage.
Okay. Thank you for the nice introduction. Myself, Dr. Ravi Kyadegeri from Apollo Cradle and Children Hospital, Jayanagar, Bangalore. So today we are going to discuss something about fever. Fever is the most common symptom uh, that will uh, bring the child to the healthcare facility. Okay, so that's the reason it is important for the parents to know some of the basics of fever. Okay, uh, as the current situation, post-pandemic situation, all the schools have been reopened. um, the children haven't been exposed to the any of the infections for the last 2 years, and suddenly they have been exposed to the n number of viruses and certain bacterial diseases. So that has resulted in flood of clinics, hospitals with children with a very high degree of fever. So today we will understand when, as a parent, when we are supposed to seek the medical help. Okay, and what are the measures that we can take at home to ensure that our child is safe and healthy, and when we really need to rush to the hospital or emergency. So these are the basic things that I'm going to cover. I'm not going to cover individual specific disease. It is not recommended, but general measures that I'm going to cover today. So first of all, we have to understand what is the definition of fever. So the definition of fever is any raise in the body temperature beyond 38 degrees centigrade or 100.4 degree Fahrenheit. So that is called a fever. So what is the main reason for fever? The main reason for fever is, so whenever there is body is exposed to certain viruses and bacteria, and that results in release of certain chemicals in the body. So those chemicals will raise the body temperature. So that is the main reason for increase in the body temperature. So the second most important fundamental question is how to measure from which all the body parts we are supposed to measure the temperature. So what are the differences in measuring with the different body parts? The gold standard, we call it as, for the measuring temperature, is rectal temperature. So the rectal temperature usually is used in the healthcare facilities. So rectal temperature measures the core body temperature, that is the central body temperature. So it is not always feasible and practically not possible to measure at home. So that's the reason we use alternative routes to measure the body temperature. The common things that we currently use is oral temperature, axillary temperature, and infrared measurement through the infrared instruments. And currently we're even using the smartphones to measure our smart watches, for that matter, to measure the body temperature. So I'll discuss about the importance of each one of these, uh, the site of measurement of the temperature. The the first one that I told, rectal temperature, usually we use this very often in the neonatal period, because the other body temperature, um, other modes, other sites of temperature measurements are not at all reliable in less than 3 months of age. So in neonates and the infants less than 3 months of age, we use a rectal temperature. Even in older children, where the measurement is not accurate, or there is a slight doubt, so we use a rectal thermometer to measure the core body temperature. So other common measurement that we use is a oral temperature. So the problem with the oral temperature is, if the child has a nasal block, if child is continuously breathe through the oral route, so the because of the dryness of the mouth, the child can have a higher temperature. Or if the child has taken any hot beverages, water, before the 20-25 minutes prior to the taking the body temperature, the temperature can go really high. So other third commonest thing that we use is the axillary temperature. So axillary temperature, the only thing is, we should ensure that the thermometer touches the edge of the thermometer, that is the sensitive part, where it has to be it has to touch the skin. And we should measure complete 1 minute for the accurate temperature. And we have to remember that the axillary temperature is 1 degree less than the core temperature. Ideally, whenever we are measuring the axillary temperature, we add 1 degree to that, 1 degree Fahrenheit to that. And if, for example, if the measurement is 98.6 or 99, we add 1 and it will become 100. So the core temperature will be around 100-degree Fahrenheit. And the most common thing that we are currently using is infrared temperatures. So infrared temperature, we use both um, ear uh, uh, and the forehead. So they are if infrared temperature used in the um, ear canal, so that is almost correlates with the core body temperature, just like a rectal temperature. So here the temperature is measured from the tympanic membrane, the ear membrane. So the temperature is almost equal to the core body temperature. Even the forehead temperatures almost correlate with the central body temperature. And the last one, we don't recommend the digital, like through the apps and smartphone. They are not that reliable as of now, because we do not know how the technology is going to evolve. As of now, we don't recommend them. So these are four ways of measuring the body temperature. So so then next concern is when we should worry. Okay, so we call it as a fever of concern. Fever of concern is any body temperature measuring beyond 102 and without proper source of infection, like without any of the common symptoms like cough, cold, vomiting, loose motion. Okay, so that is a cause of concern, because there may be underlying serious illness when the temperature goes beyond 102 without any source. So that's called a cause of concern. And second important thing that I want to emphasize is, any child, any infant less than 90 days, any infant less than 90 days with fever, you are supposed to see the doctor immediately. Okay, so the illnesses below 3 years are of serious nature, so it requires immediate attention by the pediatrician or caregiver, medical caregiver. So that's the reason any parent whose child is less than 9 months, less than 3 months, they should keep in mind that any temperature, body temperature rise, so should be brought to the notice of healthcare worker. So next thing that we're going to discuss is, what are the benefits and harms. Is all the fever is bad? No. The rise in the body temperature, as I said, mentioned earlier, there are certain chemicals that release in the body in reaction to the viruses or bacteria that enters our body, is helpful in fighting the viruses and bacteria. So earlier, when the medicine is still ancient stages, so one of the therapy that they used to have is a fever therapy. So they used to induce the fever, okay, and and to treat certain diseases. So for that matter, the fever is not all the fevers are bad. So fever to certain extent will help us, fighting back the viruses and bacteria. So when we should consider it as harmful? So remember, So any child with a pre-existing disease, like either heart disease or lung disease or any of the chronic illnesses, slightest raise in the temperature will increase the metabolic rate of the child, and it makes the heart to work hard. Okay, we call it as tachycardia. So whenever there is a high heart rate, so we are supposed to treat the child with a antipyretics. So till that period, one need not worry. Other things that we should keep in mind when the child is having a high fever, so that needs attention or treatment is, so if the child is not active, not taking anything orally, okay, baby or child has not passed urine for more than 6 hours, if the child is having continuous vomiting, continuous loose motion, okay, okay, so and there are other symptoms like rashes on the body, okay, or child is very drowsy, child is very irritable, okay, so that is a time you are supposed to uh, worry about the fever, and you should seek the medical help. And at home also you can give one dose of any of the antibiotics, preferably paracetamol, and bring the child to the hospital. So uh, one should remember the when we should be alert and give a medication. Okay, we should not treat all the fever with the medications. So what is the management of fever? So the management of fever is the management of the underlying illness, because fever is just a symptom, it is not an illness. We have to remember this. If I treat if I keep on giving only a fever medicine, so underlying flu or underlying any of the bacterial infections like typhoid, or underlying dengue fever, so these will not disappear by just giving a paracetamol. That one we have to keep in mind. Just because the temperature of the child has come back to normal, that does not mean that the child has no child is completely out of the problem. Okay, so one has to remember, even though if the temperature of the child has come back to the normal, so if the child is not looking good, not looking okay, not taking orally well, not passing urine well, so one needs to seek the attention. So second thing is, if the child continues to have a fever for more than 72 hours, this is a period you have to remember. 3 days is a very crucial period. Any child continues to have a fever for more than 72 hours, so it requires a evaluation, because there may be a secondary bacterial infections, or child may be suffering from some of the serious bacterial infection, or there is a recurrence of the child has completely cured of the fever. Fever has reappeared on fourth or fifth day. You have to remember, the most important current scenario is the dengue fever. In the dengue fever, we call it a saddleback fever. Here the fever subsides in the first 48 to 72 hours. After gap of around 1 or 2 days, the fever recurs, so that one needs to be very careful with these kind of fevers. So that is a serious underlying illness, so we have to be careful about it. So what are the medication that we are supposed to use in controlling the fever? So remember, there are so many medications in combination with the paracetamols are there in the market. Okay, we are not supposed to use any of them. The first choice of medicine, always remember, any parent we ask, we tell them to give a paracetamol like crocin, Calpol, Dolo, any of these medicines. They first reaction is, no sir, my child will not respond to them. Okay, so that is not the way to give the other medicine. That is not the reason to give other medicine. Always remember this, to give a paracetamol or acetaminophen. So paracetamol is the first drug of choice for giving a for controlling the fever. So other second line of medicine, we use a ibuprofen. Ibuprofen is the second line of drug. We also use a mefenamic acid in this high temperatures. So only 2 to 3 medicines are recommended. So some of them, those who are using aspirin, you should be aware. Aspirin is contraindicated in fever with the children. Okay, because it causes a serious illnesses like Ray's syndrome. We call it as a very serious illness. So we are not supposed to use any of these medicines, and we should not use a paracetamol in combination with cough cold medicine. There are so many medicines are there which has a paracetamol in it. So we should one should be discouraged to use those medicines. The plain paracetamol can be used once in 4 to 6 hours. Remember, the paracetamol dose is always based on the weight of the child, not on the age of the child. Okay, so don't be misled by the some of the instruction given even on the uh, bottles or on the medicines strip, that it is based on the age. So we should not use, so based on the weight of the child, appropriate calculation should be done and to be given. Okay, so remember, if you use of medicines like paracetamol for more than 4 to 6 doses, so paracetamol we recommend once in 4 to 6 hours. Usually we recommend once in 6 hours only, because to avoid repeated doses, so we always recommend to use once in 4 to 6 hours. Maximum, most of the times four times a day only. Only in rare conditions we use a 6 times a day. So any child who received more than 6 to 8 doses of paracetamol and child continues to have a fever, it is a time to see a pediatrician. Okay, so apart from this, the most important management is keeping the child hydrated. We should keep on giving a small quantity of liquids, okay, over and over, okay, and to keep the child hydrated. And second, most important thing is to minimize the clothing. We're not supposed to use excessive clothing for the child. Okay, and one more thing I want to emphasize at this point: any child with a fever with vomiting, fever with vomiting, one and fever which is with associated with the chills, okay, chills and rigor, we should keep in mind urinary tract infection, especially the girl children. So it is a time not just giving a paracetamol, because sometimes the fever can subside, but the underlying urinary infection can remain and can cause serious illnesses. Any child with fever with chills and rigors, so any child with a fever, it's not a simple fever. Usually, it's a bacterial infection. It is a time to, visit the doctor. Okay, so this is how we can manage the children. As I emphasize again, so any medication, especially the paracetamol medication, using in children less than 90 days is not at all recommended until unless prescribed by the doctors. Okay, so we are not supposed to use the medications below 90 days. So that can, that can cause, I mean, the underlying illness may be very severe and can cause a devastating effect on the child. And second thing is, what is the role of cooling? That is wiping the body with a, how we should do it better. Okay, ideally the cooling of the body should be undertaken whenever the temperature is very high, like more than 103, 104, we should use the cooling. So, and one point to remember is cooling to be done only after 30 minutes or at least 20 minutes after giving the medicine. Don't indulge in wiping the body before giving the medication, because it can cause more harm, because the outer body temperature may decrease, but the inner body temperature, the core body temperature will remains high, or it can rather increase. So that's the reason we are supposed to avoid that. And we should use a lukewarm water, not we should not use a cold water for the wiping, because cold water causes, again, uh, causes more damage than the good. So it is advisable to use a lukewarm water, okay, to uh, to wipe the body. So how do you measure the response to the treatment? How whenever we give paracetamol medicine, what are the things that we should observe apart from decrease in the body temperature? Decrease in the body temperature is one thing, that's all. So you should not rely on the decrease in the alone on the decrease in the body temperature. One, we should see that the child is hydrated. That's very very essential. So mm, the way to make a hydration is whether the child has passed urine. Okay, so that's one of the important question one should ask, whether the child has passed urine. You should ask the child to open the mouth, and you can see the wetness of the tongue. So that is another way to assess the hydration. And how is the consciousness of the child? If the child is conscious, active, alert, so then that means the child has responded well to the treatment or antipyretics. And other things is, we should see the skin of the child. Is, are there any rashes in the skin? So that is a one more important thing that we should because there may be serious underlying viral illnesses that can that can have a rashes on the body. So response to the treatment, we should assess the child's hydration. We should assess the skin of the child. We should assess the consciousness of the child. Okay, we should ensure that the child is active, alert, and accepting fluids. So that is the goal of treatment. Okay, and any and how long we are supposed to use these medications. Okay, if at all we are using a home, we're treating at home, so we should not use more than, as I mentioned earlier, not more than 6 to 8 doses of paracetamol. Any illness requiring more than 6 to 8 doses of paracetamol, so that is a time to visit the hospital. Okay, so this is a brief about the fever in children. Uh, so, 2 3 points that we have to take home messages from this seminar is, we should whenever the child is less than 90 days, any fever, we are supposed to uh, seek the medical help, and we are not supposed to continue the medications, paracetamol medications, beyond 6 to 8 doses without the consult of the doctor. So that is a time to consult that is a time to go to hospital. Okay, and any child who is not active, not accepting orally well, not passed urine for more than 6 hours, okay, that is a time to consult the doctor. Any child who has a continuous vomiting, okay, that is not a good sign. And any child who is not tolerating anything orally, so that is a time to consult a doctor. So this is a brief about the fever. And audience, if you have any questions, I'm ready to take the questions. Okay. Um, Thank you for the patience hearing. Uh, I'm ending the session here.